Come on in. Welcome to our virtual event. This is where the magic happens. I'm Dr. Jean Johnson. You can call me Doc Jean. And the purpose of this event is for us to share some of our services that we provide here at Rejuvenation for Her in Gemini OBGYN. First, I want to just give you just a brief showing of what's in the room. We have the Syneron Candela Ultra Shape Power is for fat destruction, non-invasive fat destruction, no downtime. We have the laser for hair laser removal and also for skin rejuvenation. We also have another type of skin rejuvenation, which is called the E2 or the sublative, for increased collagen production, improved skin tone and texture for all skin types. So my patients of color love this, but also my patients who don't have a lot of color also love this treatment. We have the Vela Shape, which is for cellulite treatment, skin tightening, production of collagen. Often I combine this treatment with the Ultra Shape Power because the Ultra Shape Power is for fat reduction and this is more for skin tightening. This will also treat cellulite. Last but not least, my staple product is the Core Laser. It's for vaginal rejuvenation. I like to call it feminine rejuvenation, but it's vaginal rejuvenation is what most of us know about it. It's a CO2 laser, and I'm going to spend most of the virtual session with a actual patient who volunteered to be a part of the virtual, and we're going to show a treatment, show you what it involves, and hopefully it will relieve some of the anxiety associated with what this procedure, what might be involved with this procedure. But this is a procedure with very little downtime. The only downtime is the time that you can't have intercourse, but you can go right after work. You can have this procedure before work. You can have this procedure, and it has great benefits. So it treats a great population of patients from age 25 to 75. So this is where I'm going to spend most of the virtual event talking about this. There will be a chat session at the end. You will be able to ask, and you will have access to the specials associated with this event. You'll be able to ask me about any of the services that we offer, be it body sculpting, skin rejuvenation, laser treatment. But most of it will be spent on this product because I feel like this is the one that most people are unsure about or don't know very much about. And hopefully by the time the session is over, you'll feel very comfortable to come on in and have a consultation. And we can speak on a more personal note, and you can ask as many questions as you want. So sit down in the comfort of your home, enjoy, relax, and let's get started. Just from the breast cancer treatment itself, we go through chemo or radiation, we have our breasts removed. All those three factors can affect your intimacy, your libido,
right.
You know?
Absolutely.
Because it's mind and body.
Right.
So for those women who don't want to, have hormones, or for those women who, some people need hormones. Like I said, I'm not against it. Some people need it, and if you don't have any family history of breast cancer and these things, it may be okay for you to get it. But some women will come to me and say, well, I have the hormones, I couldn't sleep, I couldn't function. If you can't sleep, you can't work, you can't do anything. So, they came because they wanted to be able to do that, but also they didn't want to have to keep increasing the dose to try to get the relief from the vaginal dryness, and the vaginal pain that they were having, because a lot of times the bioidentical, it won't treat that.
Right.
It will help with your libido, but it will not treat for when you start getting pain, vaginal pain from just the area not succumbing to intimacy. And so that's how I started with this is my journey. When I got the treatment for myself, actually I come from a family of breast cancer survivors, so it's in my genetics. And so I was the last of three sisters to develop
breast cancer, and I had a bilateral mastectomy, and I went through menopause at the same time that I had the mastectomy. And then, like I said, the chemotherapy and the radiation sometimes will shift you into menopause. Also, even worse than just someone who's going through menopause, it's like
gradual.
2 times worse,
right.
because your body changes quickly just from the chemo, and the dryness is just really it's really unbearable.
Okay.
So that's really why I look for a solution. And when I found this and I received the treatment, I just felt like I needed to share it with other women, because a lot of women really don't know about it.
Right.
And there's this stigma around it that it's cosmetic and that it's just to make it look better in the area.
Right.
And a lot of it is really functioning.
Yeah.
And really functioning for you. And so, a lot of people will try to make it seem like you're doing it for someone else. But that's in particular why I named the company Rejuvenation for her, because when I felt better, then everything that came along with it was just a plus. But it was really for me.
Good.
It was really for me. Now, treating the outside area, the laser treats that also. And when I'm there, I make it pretty too.
Okay.
So that's okay, But the main thing is treating it for function.
Okay.
And that has been like my goal, to kind of educate women.
Okay, we've already started the procedure. Do you feel anything?
No.
So the internal tissues don't really have any pain fibers. You'll feel pressure, but you shouldn't feel pain. As you know, we did numb the outside of the vagina and the introitus right at the opening. We numb that area with a local topical, because as I come out, that's the area that you may or may not feel a little bit discomfort, but the local anesthesia usually takes care of it without any problem. So that little area, that little opening, that's where most women that have like pain or intercourse, that's where they have it. But this gives you more sensation in the area, so I always go there for everybody.
Oh, good.
Okay. You're doing good. That means you're not feeling nothing. Are you feeling anything?
No, not really. Not even painful.
Okay.
It's the anticipation I can't take.
We're going to be done in a few minutes. Okay, so this is the external head. And this is what I do. I also treat this introitus area here. Now also treat the labia. Are you feeling anything at all?
I'm not feeling anything.
See, and that's the local. That local is pretty strong, and it'll stay there like for about 3 hours. thank you for coming. I hope you've enjoyed this virtual event. I hope you gained some education. I hope you're motivated now to come and visit me and see me for a in-person consultation. You can contact me through my website at rejuvenationforher.com, and my email address is docjean@rejuvenationforher.com. You can also call me 954-445-6077. I look forward to hearing from you. Hi, everyone. Thank you so much for attending our virtual event. I hope that you gained some more information, education, and I hope you've enjoyed the event. And hopefully you'll get a chance to come on in and see us and ask more questions. But for right now, we're going to ask some questions. We're going to answer some questions on the chat. Thank you so much for attending. Any questions? Ooh, I got quite a few. Okay. One of the first questions is great. Someone asked, was there any age limit? No, there's not. The treatment for the feminine rejuvenation, actually, the age range is between, my youngest patient is 25. She had 3 vaginal deliveries, and she wanted to tighten the area. My oldest patient is like 73, and she's still sexually active and did not want to continue on hormones, wanted to discontinue the hormones. So she came in to get the treatment. And nowadays, they have Viagra. So as we age, the vagina can't really keep up with Viagra without doing something else to it. So this laser treatment really helps make the intercourse a lot more comfortable and enjoyable. So there is really no age limit, 25 to, I would say, 75. And yes, it does help, in addition to helping with dryness and painful intercourse, and also the looseness that we can get over time with age or from childbirth, it helps with urinary incontinence. So that same treatment, the collagen and estrogen, the collagen and elastin that's produced from the treatment also helps to restore the area around the urethra that causes urinary incontinence, which collagen and elastin is one of those things we just lose over time with age. So this replenishes it. So it really does help a lot. I had a patient in her mid-30s, couldn't get on a trampoline with her kids because she would wet a pad from urinary incontinence. And they really get good results from this to help with urinary incontinence. It is not covered by insurance. Unfortunately, it's not. And it's probably going to take a while for it to get to that. And a lot of work of trying to prove to men that this is something that women should get. It's not, it's for function, and it's not just a cosmetic procedure. So it is not covered by insurance. The outer area does improve. So as we age, the color, sometimes we get the discoloration. It also, the labia can become more elongated. So that becomes a problem sometimes with intercourse. Sometimes it just kind of goes in and out, and that can cause some discomfort. But the laser can lighten the area as well as tighten the outside of it. So, oh, good. I see. Thank you. I got a comment from one of my patients from long ago. She was actually one of my first patients, and it has really been life-changing for her. Oh, thank you so much. Really motivates me to hear that. Okay, let's see. That was, all right, it's a lot of questions coming. Let's see. Okay. 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 So let me move on a little bit to the skin tightening around for the stomach and the stomach area with VeloShape and Ultra Shape. Okay, VeloShape will tighten the skin. It depends though on how much skin it is. So if it will tighten it. It will look better, but you won't get the same type of tightening as you would get from like a surgery if it's a lot of tissue. Like if you lost a lot of weight and it's a lot of tissue, you won't get the same result as you get from a surgery, but it will tighten it. And the issue with the tightening, remember, skin tightening is a loss of collagen and elastin. So when you tighten the skin, over time, you're still going to lose collagen and elastin because that's just part of the aging process. So it will last. It will last, but you will have to come and get like maintenance treatments. When you get the maintenance treatment, it's not a series of 3. It's just a one treatment where you have to re-stimulate the inflammatory process and you get skin tightening from that. So you will have to get some because we gain some with the VeloShape, and then of course with age we continue to lose. So over time, you gain, you lose some, you gain some with the treatments, then you lose more collagen. Then it gets a little bit, then you come in and get a treatment and it tightens back up again. You gain more collagen. The key is that you don't want to just keep losing, because then that's when you get that effect. When you look in the mirror and you're like, wow, what happened? It's continuous loss of collagen and not really doing anything to replace it. What do you say? Okay. Would you say that it amplified Maya cosmetic surgery for wrinkles? Yes, it does. If you've had cosmetic surgery before and you need to just, do some tightening of the skin, it's a perfect way to come in and tighten the skin with just a non-invasive treatment that there's not a lot of downtime. Okay, is the laser procedure an alternative to a labioplasty? Or like there is a certain vaginal rejuvenation that requires surgery. Now, the laser, if the area is too loose, then you may need surgical vaginal rejuvenation. So the laser doesn't treat all vaginal rejuvenation. So we do an exam and I can't feel anything. When you do like a Kegel, then chances are you need the surgery and not laser vaginal rejuvenation. But if I can feel a Kegel and you can squeeze my fingers, then the laser, you will benefit from having the laser, and it's non-invasive and it's no surgery, no downtime. The surgery for vaginal rejuvenation, it's going to be some downtime. But I do also get patients who get the surgery and then they come for the treatment because the surgery does not treat the tissues. The tissues are treated by the laser. The surgery will tighten the area, but if the area is dry, it's still going to be an area that's maybe not comfortable. It'll be tighter, but it's not going to be as comfortable as if you have the laser and the treatment. So we do a combination with my GYNs. We do a combination. If we need to do a vaginal treatment with a surgery, then we do that. But then we also follow up after the vaginal treatment with the laser, which will make the area, it will plump the area, really is what it does. It makes the vaginal tissues more, they expand. So it's a rejuvenation. So they function like they did. It's not going to take you back to your 20s, but it'll take you back up 10 years. And you will definitely have more enjoyment and you will just feel better. Okay, so one question is how many treatments are necessary? So for the vaginal rejuvenation, the treatment, you need 3 treatments, and the treatments are 4 to 6 weeks apart. And the cost of the vaginal rejuvenation, the total treatment is $3,000 for the treatment. For me, you can pay separate, or you can come, or you can pay up front, and then I give a discount. I give a $500 discount when you pay up front. So $2,500 is what it will cost for the 3. If you refer patients, then I can also give you even more of a discount. Okay, somebody asked the question, are there any negative side effects? I haven't had one patient, and I've done quite a few patients. I would say I've done more than 150. Um, and I haven't had one patient have any side effects. Of course, that's because they're in good hands when I do the treatment. I've had the treatment. I've done several treatments. I know how to make the treatment comfortable. I know what patients, an older patient needs a certain level of treatment on the laser. A younger patient can use another level of treatment on the laser. Because I've done so many in the wide range that I've done, this is really not it's sort of a benign treatment if you have it in the right hands. You got to have the right person doing the treatment. A lot of places you'll go, they delegate this procedure. I don't delegate this procedure to anyone. I'm the physician. In the state of Florida, CO2 laser is really only supposed to be used by a physician, and that's my laser. Let's see. Okay, so how long has it been around? Well, they've been doing it in Europe for a long time. We just about 10 years ago started doing it here in the States, maybe a little bit more than 10 years now. The first one that came out, if you might have heard of, is the Mona Lisa. And that was the initial CO2 laser, but that laser has had some mixed results. And that's why I choose the core from Candela. And I have had only success with this laser. And I'm glad that I wasn't able to get the laser for years ago with the Mona Lisa, but Candela really helped with training and everything, and I was able to purchase the laser through Candela and train with some of the people who have done the research for the laser, GYNs, and also I've trained with a plastic surgeon for this. So my results are really good, and I've really done some special things too to make this laser treatment very comfortable for women. Okay. One question says, would there ever be a time when you never recommend the vaginal rejuvenation? If so, when? I already answered that question. If the area is so loose, you may need surgery. And then too, you can have the vaginal laser after you finish the surgery, but you may need the surgery to get the kind of tightness that you want in the vaginal area. You may need the surgery. But then I will usually follow up the surgery with the vaginal laser anyway, just to make it more pleasurable and to treat the tissues. Because like I said, the surgery does not treat tissues. It just tightens the area. The laser treats the tissues. Okay, so someone asked the question, how long does the vaginal rejuvenation last? So for my older patients, that's patients who have gone through menopause, or like my breast cancer patients, I recommend that they have a touch-up once a year. So it's a series of 3, and then once a year you can have a touch-up. That's for your older patients because we have different estrogen levels from somebody who's younger. My younger patients, it may not take 18 months or maybe 2 years before they have a touch-up treatment. Me personally, I'm at the menopausal age. I'm almost 60. So I just do my treatment every year because I don't want to ever feel like I felt before I had it done. So I did my series of 3, and then I do my touch-up once a year, and I've had 5 touch-ups. So it just varies for individuals. And most people know my older 70-year-old, she went like about 18 months before she had a touch-up. But she called me and she says, it's time for me to get a touch-up. So everybody's different. But let's see. But, we work with everybody differently. So let's see. More questions. Let's see. Yeah, so the specials for this event, I am offering specials. If you want to come in for a consultation, you're going to get a text message. But yes, I am offering specials for the event for skin treatment. You have to just kind of give me an idea of what you want to get done. You can call me. You have a week. The specials are going to be on this week. You can call me. Let's see. You can call me and we can talk about the specials for what you want, because it'll take some time for me to go through the specials, everything. I have specials on the body treatment, the vaginal rejuvenation. I've already told you the special on that. Also the skin treatments, I have a special on that. So for this event, there are specials for every treatment that I have. You just need to let me know which one you're interested in through consultation or a phone call. I already talked about how long it's been around. I would say no negative side effects. No, none at all. Okay, let's see. Keep going. Okay, the same for under the chin. The chin is a little bit difficult, but I can treat also skin. I have a laser that does skin tightening under the chin. Okay, is the laser procedure an alternative to labiaplasty? It depends on how elongated the labia are. So I've had some clients that come in, if it's really long that it may require surgery, then we recommend surgery. But if it's not that long, the labia, then we can tighten it. The laser will tighten the labia. So it really is it's individual. So we would have to look at it and we have to see and talk about like what your symptoms are. Let's see. Okay, there it says, would we have to come in for an evaluation and pricing? I mean, you can, I'd rather for you to come in. I can tell you more about the laser and actually show you the hand pieces and what's involved, because it's not, I mean, that was just a short snippet of what the procedure is like, but I had to do a lot before that. I try to make you feel as comfortable as possible. I have something I do special with the laser, with the local, to make sure you're comfortable. And then also I have some other things that I treat. Most people the next day don't feel like they've had anything done. And I've had people that tell me that, oh, are you sure you did something? So that's how comfortable I make it. So it's a lot involved. And I want you to come, I'd like for you to come in to see me, because then you can actually meet me face to face, so that you can just say, well, I definitely want this person to do it. So I think that's better. Expectations and all that, I can answer more questions in person. How long does it last? Like I said, I do my touch-up every year. I probably can do it every year and a half. But like I said, I don't want to go backwards. I don't want to ever feel like I felt before. No, I don't have any financing of the procedure. But like I said, you can pay each time you come. So it's a 4 to 6 week treatment. So, that may give you time to recoup however much you would need for the treatment. Now, my breast cancer patients, they get 50% off. Their total cost of their procedure is $1,600. And then, as I don't know if many of you know, I do have a nonprofit that will help support those clients who cannot afford the cost of intimacy wellness treatments, my breast cancer patients. So you can donate, to the 501c3. It's a tax deductible donate. You can donate and pay for someone to have it through the nonprofit. But if you can't, if you can afford it, it's 50% off. If you know someone who can't really afford to have that treatment, like now we're seeing more and more younger women with breast cancer, like in their 30s and 40s, and maybe they have 3 kids and they really can't afford the cost of the treatment. Then through the nonprofit we can help some people who can't really afford it. All right, I think I answered this. Someone said she's almost 77, not on hormones, but you think I'm outside of the recommend. If your heart is good and you don't have any bad, like if you don't have a pacemaker or anything like that and you're sexually active, no, I don't think you're out of it. It's just, we have to talk about if you've been sexually active and what you've done in the area, because the area needs to be moist for the treatment.
and there are a few things we may have to do before we actually treat you. But I would say no, because it's really not an invasive procedure. Okay, eyelid rejuvenation, droopiness of the eyelids. Is the top, I would have to see you and see, is it the top of the eyes or the bottom of the eyes? There is an E2 treatment that will treat the eyelids if they're not down far. If they're not down too far. Yeah. So I do have something for eyes, and you have to just come in. And then I have one of my clients here. She says, I just want to let you know it has been a lifesaver to this day. Yes. I can't wait to see you. I can't wait to see you. Okay. What's the improvement on the outer area? I talked about that, and that it lightens the area and it tightens the labia. Come on in. I'm ready to do this. Come on in. Give me a call. I am a breast cancer patient, had both as you did. I would like to know how I can make an appointment. Oh, come on in. I can't wait. Just call me, 954-445-6077. We'll get you in. How long do you have to abstain? Okay. After receiving the vaginal rejuvenation, it's 7 days. In between is your downtime. That's 7 days in between your treatment. So most people like to come like maybe on a Tuesday. So like by the weekend, they might be okay if those are your intimate times, but it's just 7 days, no intercourse. But you can come and have the treatment and go to work. You can come after you leave work the next day. You know, it's really no real downtime. It's just 7 days in between. Now, some people also use the time of their cycle for their downtime. So if you don't want to wait to set, so you have it right around 3 days before your cycle, so that your cycle is part of your downtime. So then by the next week, you're ready. Yes, I do have something to tighten the jowls of the face. That's the Sublime. And that one is a very easy treatment. No downtime. No downtime at all. Yeah, no, of course. It says here, is there a time that the treatment is there a time the treatment should stop? Can we get treatments beyond menopause? Yes. As a matter of fact, menopause is when most people come to get this treatment after menopause. But I mean, I have a lot of young patients in their 30s to tighten the area after they decided they don't want to have more kids. They come to get the treatment. But menopause is a major, changes in your vaginal area. The vagina becomes the epithelial becomes very thin and very dry, and that's one of the reasons why it becomes painful. Now, what happens when you start having pain, you're kind of like waiting too long. So don't wait. And no, the treatment shouldn't stop. Like I said, I'm menopausal. And that was one of the reasons why. I mean, I had the breast cancer treatment also, but I also was menopausal at the same time. So, I'm doing my treatment because I'm not done. I don't know about you guys, but I'm not done yet. So I think the time to stop is when you're done. So yes, you can continue. Let's see, how long you suggest intercourse after? How long do you see? Okay, so yeah, the 7 days is down. How many sessions for the fat removal procedure? 3 sessions. It depends though. I have to see you because what happens is I need to see how large the area is. So, but I also give nutritional and exercise education. So in addition to your 3 treatments, you're going to get free education. And a lot of people think they already know how to do it, but I tweak it. I tweak your nutrition. And I'm not talking about a diet. I'm talking about a lifestyle. And I teach you how to eat and how you can still have days that you enjoy what you like having, and and still maintain a good diet. So you come in to see me and you will see a difference in how you eat and how you look at things when you go grocery shopping and everything. That all comes along with the treatment. Okay. Yes, can you send me this info so I can book a consultation? Yes. So you're gonna get a text message
Thank you.
Yeah, the answer is there in the downtime. Yes, yes. Okay, yes.
Okay.
Now, it doesn't help with the bladder, but the urinary incontinence. Now, when you say bladder problems, I don't know if you're saying you're having a problem with your bladder, but if you get that urinary incontinence, like when you laugh and you cough, that it will surely help with. Now, if it's a bladder problem that you know of, then I don't quite know about that question. I'd have to ask you a few more questions. But if you're talking about urinary incontinence, where they advertise all the time for us to be putting on a underwear that as we age. No, this really helps with that. And I don't know about you guys, but I don't want to wear like a diaper if I don't have to. But this definitely does help with that. But bladder problems, that could be something totally different. Urinary incontinence, yes. Leakage, yes, definitely. It definitely helps. That's the minor thing where you get like when you sometimes as you get older, you stand up, you get a little bit of leakage, or if you cough or if you sneeze or if you laugh, that's urinary incontinence. So definitely.
Hey,
I am
friends.
loving the question. I am very comfortable. Oh, I'm so happy. I can't wait. You can't when you come to see me, we really talk too. Like we really talk. We talk, girl talk. It's fun.
If we missed your question, please do put it back in one more time. We don't want to miss any questions.
And then I think that, okay, let me know will you be, okay, yes. All right. So you're going to get the text message, okay? And please call me. I answer my own phone. I don't delegate this procedure to anyone. And I like to talk to my clients. So when you call and you have if you come to have this procedure with me, you'll be able to talk to me. You won't be talking to an answering service or anything like that. So I gotta go, but guys, call me. I gotta get off. All righty. Thank you so much for coming.